We're going to chat a little bit about electromagnetic therapy. It kind of seems like voodoo to me. Everyone's have these new therapies, and I kind of say, tell me a little bit how you got interested in this and kind of what it's been doing for your practice.
First, let me jump off the voodoo therapy, because I think that is very accurate to what people's impressions
are.
Yeah, magnetism. You know, when they came out with those magnetic insoles, I think in the late 80s, early 90s, the Gauss, which is the energy unit, is maybe like half a Gauss, if that, in one of those insoles. So you have to have some energy to affect a change. So like we jump up to an MRI unit, which has several thousand Gauss, and there's a huge jump between, you know, what is basically an ineffective insole because there's just not enough charge there to do much, versus an office-based unit where you're actually hearing a ping, just like you would in an MRI unit, of the cycle of the magnetic amplitude up and down, and you hear that. It's very interesting. Radial shockwave, which many of us have in our offices.
Yep.
And I think it's a great tool. I don't want to knock that at all. I think it's still a workhorse of a tool. The electromagnetism offers me not as much pain for the patient while they're rendering the treatment. So it's in effect, it almost feels like static, like you're taking your laundry out of the dryer, and it just has that little kind of prickly feeling. That's it. Now, occasionally you'll get a little bit of a highlighting. Let's say I used it on my iliopsoas, you know, that front flexor muscle that really gets tight when we're sitting down. So I just use it, and it really caused this oscillation.